show, we will be discussing birth control pills. And could it be that it's a leeway for young women to be sexually active? So today we have Azisha, our teenager who is on birth control, with Ms. Teng, her guidance counselor, and Alicia's dad, Mr. Joe, Dr. Vindiola, and Dr. Chong. So, yes. So, for the first question, so what were the statistics of young women taking birth?
There's a recent study by Rachel Jones, this 2011, about the overlooked benefits of birth control pills. Birth control pills are mainly used to prevent pregnancy, but then more than half of the women who use birth control nowadays discover the other immediate health benefits. In fact, 1.5 million women take oral contraceptive pills solely for the non-contraceptive reasons. 58% may rely on contraceptive pill at least in part for purposes other than pregnancy prevention. 51% use it for cramps or menstrual pain, 28% menstrual regulation, 14% for acne, 4% for endometriosis, and 11% for unspecified reasons.
Oh, so there's so much things going on there. So who here is actually scared of getting pregnant at this point in your life? Like, I mean, of course, men cannot get pregnant, right? Or no? So yeah, like, can you imagine yourself like bearing a child for 9 months? Like any of you guys? I guess I wouldn't want that also. So yeah, so for doctor, can you please discuss to us what is birth control?
Hello. Okay, so birth controls involves one or more actions, devices, sexual practices, or medications followed to intentionally prevent or reduce the likelihood of pregnancy or childbirth. There are three main routes of birth control to prevent or end pregnancy, and these three main routes include: number one, contraception. This is the prevention of fertilization of the ovum by the sperm cells. Second, contragestion. This is preventing the fertilized egg from implantation, or this is also known as the morning after pill. And lastly, there is the chemical or surgical induction of abortion of the developing embryo or fetus.
So before we go on, we would like to show you a video because there are so many women out there who are actually so thankful for this magical pill.
Hard adventure, so scared of getting pregnant, right? This is very useful.
This not feel lang yung shape. What's that?
Too graphic, too graphic.
So moving on, another question for our doctor. How effective are these birth control pills in preventing pregnancy?
Well, to be effective at preventing pregnancy, the pill must be taken every day at the same time each day for as long as your OB prescribes it. And actually, when used perfectly, when used diligently, only 1 in 100 women will become pregnant during their first year of using this method. But then if you don't use it diligently, then only 8% of the women will become pregnant during their first year of using this method. Okay, actually, there are 2 types of birth controls, and these are the combination pills and the progestin-only pills. So the combination pills contain 2 hormones, and those are estrogen and progestin. So estrogen levels naturally fluctuate during a woman's monthly cycle. Once estrogen hits the peak level, ovulation begins. Ovulation refers to the releasing of an egg into the uterus. The egg can be fertilized as it travels from the ovary to the uterus via the fallopian tubes. Birth control pills keep estrogen at a constant level to prevent ovulation. If an egg does not erupt, a woman cannot be pregnant. And the progestin hormones are actually synthetic hormones. It increases the thickness of cervical mucus and impedes development of the uterine lining to further prevent pregnancy. Essentially, the ingredient is synthetic progesterone. When used in a birth control pill, progestin makes it difficult for the sperm to make their way to the egg to fertilize it because the mucus within a woman's cervix is thickened when progestin levels are high.
Thank you for that. So, Mr. Joe, what would you know about intercourse, birth control, pregnancy, and such, given that you're a father?
Well, as a father, growing up, we were taught a lot of things. Like, it's not true that a woman cannot get pregnant during her menstrual period. It's not all, but it is true that a woman is usually less fertile for the first few days of menstruation. But less fertile doesn't mean not fertile at all. And just to throw it out there, it's not true that if a man does not ejaculate into the woman does not get pregnant. Because once the vaginal penetration by the penis occurs, there's always a chance of pregnancy that could happen. It's also, if also a female drinks a lot of alcohol, pregnancy is not prevented. So do not drink. And 2 condoms is not for the young men out there who have been very active in intercourse. 2 condoms is not better than 1. Wearing 2 condoms will only make the condoms tear easily. Unlike 1.
Oh, thank you. Your dad knows shot. Oh, your dad knows. Anyway, moving on to our guidance counselor. So, do birth control pills actually menstrual problems? Like, there are talks about them.
Yeah, acne, especially severe acne for women, can lead to embarrassment, anxiety, social isolation, and permanent skin scarring. Severe acne can even lower the chances of employment in some industries. For some teen girls, certain birth control pills help clear up acne because the pills stabilize the fluctuating hormones that can cause extra oil on the skin and acne. As said earlier, 31% use it for cramps or menstrual pain, and 28% for menstrual regulations. Oral contraceptives eases hormonal swings, meaning they can swings too, especially those who deals with premenstrual syndrome, also known as PMS. It is because birth control pills supply your body with a constant level of estrogen and progesterone hormones. Some oral contraceptives, such as Yaz and Yasmin, can even decrease the frequency and severity of premenstrual symptoms, such as bloating, water retention, breast tenderness, and cramping.
So it helps PMS. Is it true, doctor, like your mood and things like that?
Okay. Actually, according to the Alfred Psychiatry Research Center in Australia, it's a mood killer for some, but it's also a mood killer for some women. Mood saver for some women. Yeah. Pill users are twice as likely to be depressed as non-users. Yeah, to be precise.
So what are the, Alicia, we would like to ask you, what are the side effects that are evident, once you take since you're on it, right?
Hello? What's the question again?
What are the side effects since you're on it?
I mean, like, I have like no pimples at all. I mean, I take it because I don't have pimples. And then it relieves my cramps, and my boobs got bigger. Like, I'm serious. Like, when I took it, my boobs got bigger, and I lost weight. But, yeah, I guess I also did my research. Long term, like, hello. I know that I can get, hello. Okay, I know that I can get breast cancer, and I know that I have an increased risk of heart attack and stroke, whatever. But I mean, okay, hello. Okay, I mean, like, I have a boyfriend, and like, I don't wanna risk like getting pregnant now. I mean, like, I'm not gonna take it forever. I just like want clear skin and to be safe, you know, just like anyone else.
Thank you for that. So, what do you think of this, Mr. Joe?
Well, in a father's point of view, it's I guess you can say it's natural, but you know, you still have to think of your moral values, like that. Yes, teenagers nowadays are experimenting on things, but you know, you always have to be careful when active in intercourse and the like.
Thank you for that. So, doctor, what is it true that you can get like breast cancer, things like that? Like, what are you limited in doing?
Actually, there's no direct correlation with that, but then it does risk serious cardiovascular effects. You know, like when you smoke while taking birth control pills, it gives you a higher risk of developing blood clots, especially for women over 35 years old. And actually, when you drink detox teas like drinking teas, like green tea and stuff, it affects the accuracy of the pill. So you should take note, like don't smoke and don't do detox diets.
Wow, so much information. Anyway, so like moving on to our main topic. So is it true that when it started, when birth control was produced, did it actually affect women's morals and like being liberated and everything like that?
Okay, so to understand the history of birth control pills. We have to go back to the 1960s, 1950s, where Margaret Sanger had an idea to create the magic pill, which is birth control, so that they won't have any problems with family planning. That was the first objective of the pills first. So in time, we've got Gregory Pintos, a scientist that would soon develop the right amount of substances that would in turn inhibit ovulation, which corresponds to being pregnant. So, in your question of if the pill is used for those who would decrease young women the sexual activity, well, it's just a myth. So, according to Elaine Tyler May, also an historian, this idea is largely a myth. So, as May explained to a Stanford audience, the pill's impact on the sexual revolution is unclear. What is clear is that the drug had a far greater impact within marriage itself. So it's pretty self-explanatory that the pill was widely used for family planning, not for sexual activity. So when the birth control pill arrived on the market in 1960, within 2 years, 1.2 million American women were on the pill. Worldwide, it was 12.5 million. That's a lot. So we can say that these women were not, were not influenced by sexual activity. Rather, they were influenced by family planning. So, as a contemporary physicist explained, the pill does not make people decide to have sex. It is after they decide to have sex that they go get the pill. So, for most young women these days, they take the pill after their first time. So, which means that they weren't planning on taking the pill first. So, they didn't have any idea what the pill would do to them. So given that the trend towards sexual freedom occurred so gradually, and given that most women did not use the pill for their first sexual encounter, May argues, the historian, argues that it makes little sense to say that the pill caused a sexual revolution.
Thank you for that. So, we would like to have our question and answer portion.
Questions? Benj, Carl, Kim?
Any questions to the guys
Since
who want to get pregnant?
You raised your hands earlier when they asked how many of you are scared of getting pregnant. And also,
To the guys at the back that do not want to get pregnant, now's the time.
maybe I should ask the OBGYN, but this is just out of curiosity. You said if you take it will prevent acne or remove acne, or make your skin clear, right? But that's only for women. So what about if gays take it? Guys, I mean, yes. Will it have that effect also?
Miss
Audience member.
Thank you for that question. I don't think it won't have the same effect because we have different hormones.
Okay. And then will they grow boobs? No, it won't have that effect. Because I heard that some gays they take something like pills to have feminine features. It's estrogen. So what's the main ingredient or composition of the birth control pill?
Progestin and estrogen.
So if guys take it, they'll develop breasts. I was going to say feminine features. And it doesn't have side
more of a cardiovascular effects.
That's it. That's
It heightens the risk of blood clots, especially for women over 35 years old.
But that's it. Does it cause? Have they done studies on whether it causes other illnesses later?
There's no direct correlation. Like, yes, for example, the woman takes this and then takes birth controls. Like, it causes her to have, for example, she gets breast cancer. But then that's not mainly the reason why she got breast cancer.
So there might have been other factors.
Yeah, there are other factors. So yeah, there's no direct
So
correlation.
since the 1960s, it's been safe, right? No adverse.
Well, there in the 1960s, there were reports from 132 blood clots, including 11 deaths. But but the company conclusively demonstrating that the blood clots are a direct result of the pill. There are no conclusive evidence. So, well, if some people were complaining that it was the cause, probably it was intertwined with using it with the pill with smoking. So it might have affected the pill's effect.
Also, one of the reasons